Welcome to the deep dive. Today, we're really getting into the weeds on clinical audits in healthcare.
Yeah, it's a big topic, but super important.
Absolutely. We've pulled together insights from, well, quite a few places. We're looking at Joint Commission International JCI for that global view.
And NABH from India giving us a national perspective.
Right, plus some practical stuff from Supremediq Consultancy, the bigger picture from ASQA.
And just some core texts defining what these audits actually are and how they work.
Exactly. So our aim today, pretty simple, really. We want to give you a clear picture of what clinical audits involve, why they're so critical, and, how they actually happen on the ground.
If you've ever wondered how healthcare quality gets checked and improved, or maybe you work in that area,
then this is definitely for you. We'll try to cut through the jargon and focus on what really matters.
Okay, so let's start with the basics. What is a clinical audit? Fundamentally, it's a structured way of looking at patient care. We compare it against certain standards, benchmarks. The QI playbook calls it a systematic review against standards to improve patient outcomes. Simple enough, right?
But it's more than just ticking boxes, isn't it?
Oh, definitely. It's a quality improvement thing. It's systematic. Yes, you look at explicit criteria, but the key part is implementing change.
Right, that implementation piece. One of our sources really stresses that. It's not just finding problems.
It's doing something about them. And crucially, it's not about blaming individuals.
That's vital. The goal is system improvement, measuring the gap, essentially, between the ideal, like those evidence-based guidelines.
And what's happening day to day.
So where do these standards come from? You mentioned benchmarks.
Good question. They come from all over, really. Evidence-based guidelines are a big one.
Okay.
But also local protocols developed within a hospital or even broader national or international benchmarks.
And that's where organizations like JCI and NABH fit in, setting those standards.
Exactly. JCI sets rigorous international standards for quality and safety. NABH does similarly within India. They provide that framework.
Makes sense. So once you have the standards, what's the process? The audit cycle.
Right, the cycle. It usually follows a pattern. First, you nail down those standards for the specific thing you're auditing.
Okay.
Then data collection. This means digging into patient records, maybe watching clinical processes, sometimes interviews.
Getting the real picture.
Precisely. After that, you analyze the data. Compare what you found to the standards. Where are the gaps?
Identifying the shortfalls.
Yep. And based on that analysis, you develop an action plan. What are we going to do about these gaps?
Practical steps.
It needs to be practical. And then, crucially, you re-audit later. Did the changes actually work? Did things improve?
Closing the loop.
It's that iterative cycle, constantly checking and improving.
And NABH has specific points about documentation here.
They do. One text mentioned recording findings on a checklist with predefined parameters. Very structured.
Keeps it consistent.
And they emphasize documenting the remedial measures taken, making sure they're based on a root cause analysis. Why did the gap happen? And then recording the improvements, completing the cycle formally.
So it sounds like a lot of work. Why go to all this trouble? What's the big payoff?
Well, the number one reason has to be improving patient care. Directly.
Right.
By finding and fixing practices that aren't up to scratch, you get better outcomes for patients. It's that simple, really.
And it helps ensure everyone's following the best advice, the guidelines.
Absolutely. It reduces that variation in care. You want patients to get effective, evidence-based treatment consistently. JCI's international standards really push for that consistency globally.
It also sounds like it boosts accountability. Transparency.
It does. When practices are regularly reviewed, it creates a culture of, openness and responsibility. People know things are being looked at.
Like that quote from Burjil Farha Hospital about JCI accreditation strengthening community confidence. That ties in.
Exactly. Trust is a huge factor in healthcare. Audits help build that.
And it allows hospitals to see how they stack up. Benchmarking.
For sure. Comparing your performance to national or international standards tells you where you're doing well and, maybe more importantly, where you could do better. Continuous improvement fuel.
Plus, sometimes it's just required, right, for accreditation?
Often, yes. JCI, NABH, they're accrediting bodies. Audits are usually part of that process.
And companies like Supremediq actually help hospitals get that NABH accreditation.
Right, showing how integral it is. And even ASQA recognizes JCI standards and works on external evaluation systems. It's all interconnected in the quality assurance world.
Okay, so we see why it's important. Let's talk nuts and bolts. How do you actually do a clinical audit? Step one.
Step one is picking your topic. What are you going to audit? Focus on areas where you think there's room for improvement.
Like?
Could be adherence to clinical guidelines, maybe a safety concern that's popped up. Hand hygiene is a classic example. Antibiotic prescribing is another big one.
Or maybe looking at specific patient groups or procedures.
Yeah, one text mentioned things like long stay cases, specific operations, vulnerable groups, or even if there's a sudden spike in post-op infections, for instance. High-risk or high-volume areas are common starting points.
Got it. So you pick the topic, then you need the standards for that topic, right? The criteria.
Exactly, and these need to be really clear. Evidence-based, measurable. Are you using national guidelines, local protocols, best practices?
Measurables is key, I guess.
Absolutely. Like, for antibiotic prescribing, your criteria might be what percentage are prescribed according to guidelines? Is the diagnosis documented before prescribing? Needs to be objective, justifiable, with realistic targets for the patients you're looking at.
Okay, topic defined, criteria set. Next up, data collection plan.
Yep. How are you going to get the information? Needs to be systematic. Reviewing patient records is common, but maybe surveys, interviews, direct observation. For surgical audits, you'd look at up notes, post-op notes, outcomes data.
And you need to think about sample size bias.
Crucial. Collect what's essential, make sure your sample is representative, and try to avoid introducing bias in how you collect it. Rubbish in, rubbish out,
Makes sense. Data collected, now what? Analysis.
Now the analysis. Compare the data you gathered to the standards you set. Where does practice fall short?
Finding the gaps again.
And trying to understand why. Root causes. If antibiotics are delayed, is it diagnosis issues? Staff workload? You dig deeper. This is where you really recognize the deficiencies.
Okay, analysis done, gaps identified, maybe some root causes pinpointed.
Yeah.
Then comes the action plan.
Okay. What are you going to do about it? The plan needs to be clear, practical, focused on improving things.
Like the hand hygiene example.
Yeah.
Low compliance leads to.
Maybe more training, visual reminders, bode monitoring, specific solutions designed to fix the specific problems you found.
And then implementing those changes. Sounds like the hard part sometimes.
It often is. It takes resources, training, good communication, getting staff on board and engaged. Change isn't always easy. It needs a planned program, feedback.
Real effort involved.
Definitely.
And finally, you can't just implement and walk away. You need to re-audit.
Absolutely essential. Did the changes actually work? Did the numbers improve? Did patient outcomes get better? You have to check.
And if not,
Then you adjust. Maybe the action plan needs tweaking. Maybe you need different changes. It's about evaluating the whole process, too, learning for next time.
that surgical site infection example really brings this home, doesn't it?
It does. They had to concern SSIs after orthopedic surgery.
Okay.
They audited things like preoperative antibiotics, sterilization, monitoring,
And found.
a link between delayed antibiotics and higher infection rates.
Oh.
So the action plan involved streamlining antibiotic protocols, more staff training, closer monitoring.
And the result.
A significant drop in infections
Yeah.
shows the direct impact these audits can have when done right.
That's a powerful example. And thinking about the people involved, there are ethical points too, like confidentiality.
Yes, very important. Patient and staff anonymity must be maintained throughout. No names in reports or discussions. Protects everyone involved.
Good point. And briefly, you mentioned accreditation earlier. Those hospitals going through JCI accreditation, they cited other benefits too, didn't they?
They did. Things like better team building, improved coordination between departments, learning opportunities, even a competitive edge.
Strengthen community confidence, we mentioned that. Better risk management.
Yeah, and just fostering that overall culture of patient safety. It seems the process itself, not just the stamp of approval, brings value.
Okay, so let's try and wrap this up. Clinical audits fundamentally are this systematic process.
Crucial for checking and improving healthcare quality and patient safety.
By comparing what's done against standards, finding areas to improve.
Making changes and then checking if those changes worked. It's that cycle.
A cornerstone of continuous quality improvement, and often, like we said, needed for accreditation by bodies like JCI and NABH.
Definitely. It's embedded in how good healthcare operates now.
So here's a thought to leave folks with.
Okay.
Given how structured audits are in finding and fixing problems in something as complex as healthcare, could we take those principles, setting standards, gathering data, analyzing, implementing change, checking again, and apply them more widely?
Interesting. Like outside healthcare?
Yeah. To other complex organizational challenges, what could other fields learn from healthcare's commitment to this kind of systematic improvement?
That is a good question. The discipline of that cycle it might have broader applications, looking systematically at performance against a defined good. Something to chew on.
Definitely something to think about. And if you listening want to dig deeper into accreditation standards or quality improvement methods,
check out the resources from Joint Commission International, NABH, ISWA. Lots of great information there.
for sure. Plenty more to explore if this has sparked your interest.